Hi, welcome. Tonight I wanted to talk a little bit about sleep. So, we all have heard that we're supposed to get 7 to 9 hours of sleep a night and that is good for our health. But what exactly is going on when we sleep? So, the truth is that scientists don't know the whole truth as to why we sleep. But we definitely know that sleep is required for our body and mind to rest and rejuvenate. So during sleep, we are making memories, we are allowing our brain to clear out neurotoxic chemicals, we're allowing our body to repair and rejuvenate. And probably what we know most about sleep is what happens to people when they don't get enough sleep. So there definitely seems to be a link between chronic disease and lack of sleep. So some examples are diseases such as fibromyalgia or chronic pain syndrome, depression, obesity is linked to lack of sleep, high blood pressure, diabetes, cardiovascular disease are all linked to lack of sleep. So we do know that getting enough sleep is very, very important. And on average, for an adult, that's usually about 7 to 9 hours of sleep. Kids require more sleep based on their age. And some adults maybe get away with less sleep and really don't have any issues, but those are generally the outliers. Most people do require 7 to 9 hours of sleep. So if you're not getting enough sleep, what are some things that you could do? And that is where the term sleep hygiene comes into play. So I don't love that word, but it is what we use to describe the different things you can do to kind of help ensure better sleep. So the number one thing that most people need to take a look at is their caffeine intake. So caffeine has a half-life of 8 hours in most people, and that can vary based on your genetics, but on average, it's about 8 hours. So if I drank a cup of coffee in the morning, then 8 hours later, I'd still have a half a cup of coffee in my system. So I usually tell people to stop drinking caffeine about 10 in the morning in order to prevent the caffeine from keeping you up at night. And a lot of people will tell me I can drink, coffee right before I go to bed and not have any trouble sleeping. And that could be true. There are some people that are super metabolizers of caffeine and they may not have an issue. But if you are having trouble sleeping, it's worth trying to cut back your caffeine and maybe not drinking after 10 in the morning and seeing if you sleep better. So that's one of the first things you can do. The next important thing is to make sure that sleep is a routine. So you're going to bed about the same time every night and waking up about the same time every morning. That way your body gets into a circadian rhythm that it is used to and comfortable with and gets the idea that it's time to go to bed and now it's time to wake up. And there might be exceptions to this. If you are sleep deprived through the week and you need to sleep in and catch up on a little extra sleep on the weekend, that is okay. That's not an issue. But overall, trying to make sure that you're going to bed the same time every night and waking up the same time every morning is important. Another important thing is to make sure you're wearing yourself out during the day. So during the day, you are physically active, you are accomplishing chores, and you're kind of basically wearing yourself out so that your body and mind do require sleep at night. If you're sitting around all day, you're not going to be as tired and not going to require as much sleep as if you're physically active. And then it's also important to get yourself ready for sleep when it's bedtime. So about an hour before bed, try not to do anything stimulating. So try not to be watching TV, try not to be on your phone. We do know that screen time might be extra detrimental to time right before sleep because of the light. There's theories that the blue light from the screens may be a stimulating light to our brains and be more like a sunrise type light. And so it might not be giving the right signals that it's time to sleep. And also because the activities that you're doing right before sleep might be stimulating, and that makes it harder to kind of wind down and rest before it's time for bed. So something I recommend is getting off of all screens about an hour before sleep and then taking time to do something kind of inspiring. Maybe you read something inspiring. Maybe you do some prayer or meditation. Maybe you do some deep breathing. But basically, you're winding yourself down. You might even turn the lights off and have candlelight instead of the bright lights right before bed. And another part of sleep hygiene is your bedroom. So the idea is that your bedroom is for sleeping, not for doing work or watching TV, but that once you finish up your day and do something relaxing before sleep, such as reading something inspiring or stretching or doing some breathing, then when you go into the bedroom, it's time for sleep. So keeping that kind of separate from your bedroom is important. So, in summary, some of the important parts of sleep are to avoid caffeine past late morning. So, maybe 10 in the morning, you stop drinking caffeine. It's important to wear yourself out during the day. So, being physically active and mentally challenging yourself. And then it's important to kind of let your body know it's time for bed by turning down lights, turning off screens, doing some sort of bedtime routine, such as stretching, deep breathing, reading something inspiring, and getting your body and your mind ready for sleep. And then leaving the bedroom a place just for sleep so that your body and mind receives the signal when you go into your bedroom that it is time to sleep. So I hope that helps you get better sleep. Take care.